Analytic Epidemiology. Understanding the why and how. In public health, it's not enough to know who gets sick, when, or where. We also need to understand why and how health problems happen. That's where analytic epidemiology comes in. While descriptive epidemiology maps out the basics, who, what, when, and where, analytic epidemiology digs deeper, asking the tough questions. Small diamond. The main goals of analytic epidemiology: find and measure associations between exposures and health outcomes. Test specific hypotheses that emerge from earlier descriptive findings. Identify causes, not just correlations, using evidence that includes timing, consistency, and biological reasoning. Small diamond. How it's done. Analytic epidemiology relies on powerful study designs. Case control studies, looking back to compare those with a disease to those without. Cohort studies, following groups over time based on exposure levels. Randomized controlled trials, the gold standard for testing interventions. Each method uses comparison groups, and each requires careful statistical analysis to find real patterns, not random noise. Small diamond. The power of biostatistics. Statistical methods turn raw data into answers. Tools like regression analysis help untangle the relationships between multiple risk factors and outcomes. We use measures like odds ratios and relative risk to quantify just how strong a connection really is. But it's not just about finding associations, it's about making sure those findings are valid. Analytic epidemiology works hard to minimize bias, control for confounding variables, and avoid chance errors. Small diamond. Real-world applications. Analytic epidemiology helps us link health behaviors like smoking, diet, and exercise to disease outcomes. Study environmental exposures, from pollutants to workplace hazards, and their biological effects. Set safety standards based on real risk data. Evaluate interventions to see what actually works in changing health outcomes. Techniques like spatial statistics even let us map exposures across neighborhoods, showing where risks and resources are distributed. Small diamond. The big picture. Descriptive epidemiology gives us the map. Analytic epidemiology gives us the compass to understand why patterns exist, and what we can do about them. It's the scientific engine driving public health forward, from identifying risks to designing smarter, stronger interventions.